Hello friends, I am Dr. Goel. I am a surgeon. I am Director of Department of Surgical Gastroenterology, Minimal Access and Bariatric Surgery. Our department has accredited training program for minimal access surgery and surgical gastroenterology by National Board. It is one of its kind department in this part of the world. So today we are going to talk about obesity, overweight, its problems, long term and short term, and how do we manage overweight and obesity problems. As all of us know, obesity has gained so much of popularity today because every third person is obese in our country. According to one recent studies, every fourth kid in Delhi is obese. This is a huge problem, friends, because we are a country of young people. If we do not take measures today, we are going to face its consequences. How do we calculate obesity or overweight? There is a very simple formula called body mass index known as BMI. We calculate BMI by dividing weight in kilogram to height in meter square. Normal BMI is in the range of 18 to 23. Anybody who has BMI of up to 29.9 is supposed to be overweight, and anybody who has a BMI of more than 30 is called obese. Obesity today is in epidemic proportion. It is the largest epidemic world has ever seen. Imagine the magnitude of problem because of obesity. Obesity most often does not come alone. It is associated with many diseases like diabetes, high blood pressure, increased cholesterol, decreased fertility, increased pain in the joints, arthritis, increased uric acid. There are various kinds of cancers which are more common in people who are obese, especially in women, like breast cancer, ovary cancer, uterus cancer, food pipe cancer, stomach cancer, liver cancer, colon cancer. The list is never ending. Also, there is a problem in women called polycystic ovarian disease, where the menstrual cycle is not regular. These all are problems associated with obesity. There are various more, like problem of brain, where patient can have paralysis, patient can have chronic kidney disease, patient can have stones in the gallbladder, patient can have fatty liver, which can in turn leads to fibrosis in the liver, cirrhosis and cancer of liver. My idea is not to scare you, but to let you be aware of the problems of obesity. So let's see how we can deal with these problems. Obviously, we know that natural method is the best method. If we change our lifestyle, where we do physical activity of some sort, whether it is brisk walking, whether it is going to gymnasium, whether it is picking up a sport or picking up a hobby like dancing. The idea is to increase your physical activity and develop healthy eating habits. It is of very importance to know that dieting does not constitute in eating healthy. We never advise person to diet, but yes, we do advise that person should eat healthy in every meal. When we say healthy, what it means? It means focus more on proteins, take high protein diet, less carbohydrate and less fats. Also take care that you get enough nutrients in terms of vitamins. All this will constitute a healthy diet. It is not very difficult. You can contact any nearby nutritionist or dietitian who will be able to guide you what a healthy diet would mean and how you should adapt to it. But the onus is on us to lead a healthy life. For people who become very obese or who are suffering from other diseases associated with obesity like diabetes, hypertension or any other disease which we have just discussed, for them there is an option called bariatric surgery. Bariatric surgery means that we do surgery to reduce fat. There are various kinds of bariatric surgery. I am going to discuss two types which are very common. One is called laparoscopic sleeve gastrectomy. As all of us know, stomach is like a muscular bag. It is stretchable. It can accommodate up to 4 to 5 liters of food which we eat. It also secretes a hormone called ghrelin, which is also known as a hunger hormone, which makes us hungry, which also gives us craving for food. So in laparoscopic sleeve gastrectomy, we remove roughly 80% of the extra stomach which is stretchable, and this is the portion which secretes ghrelin hormone. So now the new stomach is of banana shaped. It has very low capacity, so you have to eat very small. In fact, you cannot eat more than 40, 50 to 100 ml at one point of time. It also does not have hormone ghrelin which makes you feel hungry. So one gets satiety or feeling of fullness much earlier as compared to normal people. In turn, when your eating capacity reduces, your calorie intake reduces, hence person starts losing weight. That is just one part of the surgery. There are certain neurohormonal changes which happen in this surgery which are beneficial for our body. All these hormonal changes will lead to disappearance of diabetes, resolution of blood pressure, resolution of high cholesterol, resolution of chances of getting cancer, fertility improves, menstrual cycle becomes better, so PCOD improves, obstructive sleep apnea, which is a very important common problem which can be life threatening in some people, improves within 7 to 10 days. So it not only reduces your weight, but it also helps you in resolving lot of diseases which are present along with obesity itself. I am often asked, what are the complications of bariatric surgery? Well, I am going to deal with the complications little later. Let me talk to you about the second procedure which is known as Roux-en-Y gastric bypass. So laparoscopic gastric bypass is another procedure where we do not staple whole of the stomach, but we create a small pouch on the top of the stomach with the capacity of around 30 to 50 ml, and we join this pouch with the small intestine. So whatever we are eating goes down directly to the small intestine by bypassing stomach and pancreas. This helps in controlling sugar slightly better as compared to sleeve gastrectomy. This is a very popular procedure also as a sleeve gastrectomy. The job of these two procedures is, as I said, is to reduce the calorie intake and also to start good hormonal changes in the body which leads to resolution of other diseases which come with obesity. Let's come to complications, because there is a myth in the society that bariatric surgery is very dangerous, it has a lot of complications. Well, let me be very frank. I cannot say that this procedure has 0% complications, but so is true for any other operation or any other procedure. But the rate of complications is very minimal, comparable to any other procedure. So common complications which can happen is bleeding, leakage from the staple line, and clotting of the blood in the veins, which is called deep vein thrombosis or pulmonary embolism. The incidence of these things are between 2 to 5%. Most of the times we are able to diagnose bleeding or leakage on table as we test it, but they can also happen in the early post-operative period. We do take adequate precautions to make sure that bleeding and leakage should not happen, but obviously I cannot guarantee that there is a 0% chance of that not happening. But the good thing is, if bleeding or leakage happens, the treatment is available. There are various treatments which are available, which can vary from patient to patient, situation to situation, but it is manageable. Chances of life risk is around 0.2%. It is also comparable to any other procedure commonly done. I think the good thing is that today we have lot of trained teams available in our country who are routinely performing bariatric surgery. One must choose very carefully While choosing your team, you must remember you have to go to a place which has good infrastructure, which has a good team, not only in terms of surgeon, but in terms of anesthesia, in terms of ICU care, in terms of bariatric nutritionist, in terms of physiotherapist. All this form a very essential part of any successful bariatric program. Another common question which we are asked is, can I regain weight back? Answer is yes. If you do not inculcate lifestyle changes in your routine, there is a possibility that you can regain some of your weight. That is why it is very important to be in touch with your treating unit regularly and keep getting inspired to do right things, to do some sort of physical activity and to eat right. People who keep themselves in follow-up with their treating unit have seen to have better results over a period of long term. Most of our patients after surgery, when they come back to us, the common thing which they say is, Doc Sahab, this is a new life which we have got. And it is so true, because you are able to do so many things now which you were not able to do before. Well, you will be surprised that we get patients, we get couples who are staying together but they have not had sex for last 3 to 4 years because of obesity. After bariatric surgery, the sexual life improves drastically. The hormones which are responsible for better sexual life improves drastically. Another common question which we are asked is, can a young lady become pregnant after bariatric surgery? Well, the answer is yes. The chances of girls becoming pregnant post bariatric surgery are in fact higher, because of obesity sometimes your fertility is down and you are not able to conceive. We have had so many instances where our patients who were not able to conceive before surgery have conceived after bariatric surgery. Well, this is a second life, my friends. One has to learn to live healthily, not make mistakes which you have made in the first life. So I would appeal that whenever you are choosing bariatric surgery, I think it is also very important in your mind to think that you have to follow certain lifestyle changes which are not difficult, it's only in the mind. And when I say lifestyle changes, I only mean by doing some sort of physical activity on a daily basis and eating healthy. I wish you all the best in your endeavor to live healthily. Thank you, friends. To know more, please subscribe to our YouTube channel.